Hey, Max Gordon with 3TV and CBS 5 here. Do you think that we're opening up a little too quickly here in Arizona? And what's your advice to people who, might be tempted to go out and celebrate for St. Patty's Day or go on a trip for spring break?
Certainly, again, we are continuing to see COVID-19 within our community. And we know that we've been able to be successful now by maintaining our masking and maintaining our social distancing, through this. With the change and the mutations of this virus and with the variants that we're seeing, we continue to need to maintain that vigilance. My recommendation for folks is let's continue to do vaccination. Let's continue to get people vaccinated through this. And not go hog wild, so to speak, going out, having large gatherings where we're not wearing our masks of that. So we don't see and we don't have the chance of seeing a large wave here within the next, 3 to 4 weeks.
Hey, Colleen Sikora with 12 News here. For maybe people who decide, I think maybe for me, not me personally, but, people say like, oh, maybe for me, it's safe to go out for St. Patrick's Day. It's safe for me to travel to Florida or Texas or California for my spring break. How big of a risk, are they taking for contracting COVID?
We certainly, again, COVID has not disappeared. So those same risks that were present before, still exist today. So even maintaining your mask, even maintaining your social distancing around that, the risk that the virus and you can contract the virus is still there. So it is not, inconsequential that you may be able to contract this. Again, those same things have applied as we've seen throughout the pandemic. Those that are symptomatic, we know that they have that and are isolating themselves. Those that are asymptomatic but still may be shedding this virus are still present within the community. So that risk is still there until we start to get a large, more individuals vaccinated, we start to see this virus continue to decrease in its prevalence from there. These gatherings, again, tomorrow, spring break, certainly increase our risk that we are going to see a large spike here again in the future.
And one follow-up question, as you kind of look at, where we stand on vaccinations and kind of, the light at the end of the tunnel, if you will, when do you think you can, breathe a sigh of relief, if you will? When do you think that the healthcare system can breathe a sigh of relief and the community too?
So I think that's a wonderful question, Colleen. We will continue to see COVID-19 disease for quite some time within healthcare delivery. It will never totally go away. Our goal here is to get it down to a point where we're able to manage this and be able to continue to vaccinate individuals for the prevention of anybody having the severe illnesses that we've witnessed, last summer and again this winter. We'll breathe a sigh of relief when we have vaccinated and had the opportunity to vaccinate everyone that wishes to be vaccinated, and we start to see this number continue to decrease.
Yeah, Dr. White, Steve Clausen with the Arizona News Radio Network. To follow up on that point, getting people vaccinated who want to get vaccinated, we have seen surveys recently and a lot of public opinion polls and so on that a number of people say they will not get vaccinated. They don't want to get vaccinated. How much of an issue is that in reaching the point of herd immunity?
It is a large issue. Vaccine hesitancy and us not being able to, vaccinate the majority of the population is a concern. and allows this virus to continue to perpetuate within the community and continue to be spread around. And again, increases the chances that we will see severe illness and ultimately and possibly death in a large number of people. So our goal is to continue to educate everyone around the safety of this vaccine, around the efficacy, how well it works of this vaccine, and really encourage individuals to become vaccinated from this, because truly it will help us get back into a more normal pattern of behavior and really help protect overwhelming our healthcare delivery systems once again.
So it looks like we hit a new milestone here in Arizona with 1 million people, or at least 1 million people getting the second dose. So what is your message to those that have gotten both doses and that are looking forward to travel? For them, are the recommendations the same, or should they do it with caution?
Yeah, the CDC continues to recommend against non-essential travel, even today, even of those folks that have been vaccinated, because again, the risk is still present with COVID-19 disease, still prevalent in every state across the United States and throughout the world of this. The vaccine, unfortunately, is not 100% effective. We know that it has some, folks that it does not have that 100% mark around it, but we need to continue to do those things around it and continue to protect ourselves from there. So at this particular point, again, non-essential travel is not recommended by the CDC.
Melanie McCackern with the Hertel Report. I'm wondering about vaccination rates within the Valleywise Health system. What's the percentage of staff that are currently vaccinated? And are you seeing any signs of vaccine hesitancy among staff that you think the public needs to know about?
Yeah. Melanie, is a great question, and unfortunately, I don't have a good answer from that. The way that we did vaccines within Maricopa County with our point of distribution network, many of our staff were vaccinated outside of our healthcare delivery system, at one of the regional pods within the county. So I don't have a precise number of those that have been vaccinated. I'm working to collect that data, for self-reporting from our employees as we speak to that, but I don't have that today. In my anecdotal conversations with our staff, the majority of staff have been vaccinated and will welcome the opportunity to get vaccinated. And those that have not, we continue to work with them, much as I've said before, around educating individuals and really demonstrating the importance of the safety of the vaccine and how effective they are in preventing these severe illnesses around that. I have time for one more question from folks.
I'll ask it if nobody else has one. As far as just Arizona's progress, where do you see the state going? Are things in a positive trend? And, how are things looking just where you stand right now?
Perfect. Yeah, great question, Max. I truly believe the state of Arizona and our community has done a phenomenal job around this. We have continued to see the excitement around the access to vaccine. Those that are eligible to be vaccinated, signing up for their vaccine and wherever they can get it delivered. So that's a very encouraging sign. Certainly the decreasing case counts that we see as reported by AZDHS on a daily basis are encouraging signs. All of these truly are pointing that Arizonans are doing what they need to around being safe, around us being able to come into our new normal as we transverse through this COVID-19 pandemic. The key here is just really, getting us to that finish line over the next, over the next month, 2 months, as we continue to vaccinate folks, as we expand that access to do that, really being able to be vigilant to get us to that endpoint. Again, my thank you to everyone. I truly thank you for all of your support and, your organizational support and getting our message, to the community. So thank you for all that. And I hope everyone has a wonderful day. So thank you all.
Thanks for your time, Doctor.
Thank you.